Hello, and thank you for joining me today. My name is April Neptune, and today's presentation is on maternal mortality in the United States and the ethical considerations to policy solutions. While this is a brief presentation, I'll provide you with the objectives that we can either revisit at the end or by request. Maternal mortality in the United States continues to be a serious public health issue that should raise alarm, especially with the overturning of Roe v. Wade in the last year. Despite the U.S. being a highly industrialized nation, there continues to be a concerning increase in maternal mortality rates over the past few years and even decades. More women are dying during or shortly after childbirth in the U.S. than many other developed countries. This graphic illustrates how the U.S. continues to be an outlier among industrialized nations. As you can see, the United States is nearly 3 times higher than that of France, the country with the next highest rate of maternal mortality. The enormous issue with maternal mortality rates in the United States is outlined by racial and social economic disparities, with Black women being disproportionately affected. Understanding and addressing the complex factors that contribute to maternal mortality is crucial to safeguarding their health and well being of all pregnant individuals. So, what is causing the increased maternal mortality rate in the United States? There are numerous items that contribute to poor maternal outcomes in America. Unaffordable insurance coverage, high medical costs, screenings not completed or offered due to costs or insurance coverage, implicit bias or racism in the medical care, fragmented care, limited access or effective primary care to better prevent and manage chronic health conditions, and limited or no postpartum care are all contributing factors to maternal mortality. However, when you think back on the graphics earlier, it is easy to see how other industrialized nations, you can make the assumption that universal healthcare plays a significant role in decreasing maternal mortality. Uninsured or underinsured individuals may struggle to pay prenatal visits, tests, screenings, and medications. These barriers to access can lead to delayed or inadequate prenatal care, which can have negative effects on both maternal and fetal health outcomes. Not only that, the differences in insurance coverage may prevent a screening or a test from being performed, which can delay treatment or other referrals to specialists. Having different access to medical care is a problem in the United States. A solution to this problem might just look similar to what happened in 1972 when was extended to cover the high cost of medical treatments for those suffering with end-stage renal disease. Kidney failure and ALS are currently the only two medical conditions that allow a person to enroll on Medicare coverage regardless of age. Medicare can also be added to private insurance or solely used by itself for these medical conditions. A person can choose not to enroll in Medicare if they wish not to do so as well. Medicaid now currently serves as the insurer for about 42% of all pregnancies in the United States. The government is already covering the costs of around 2 million births each year. However, many women are not eligible for Medicaid before pregnancy or after 60 days postpartum. A policy for enrolling all pregnancies onto Medicare will allow for 1 year postpartum care and primary or specialist visits during pregnancy. This will allow for equal standard of care of services to be provided to all pregnant women. Screening should also be included with an opt-out feature. This will allow for referrals for many specialists like mental health care or other therapies. This can reduce the stress on pregnant women for affordable health care during pregnancy, and that is essential as it has been shown that the fetus can react to stress even into their adulthood. The United States Constitution does not typically protect positive rights like prenatal care. However, I would argue that maternal mortality is a growing concern that needs protections like universal health care. Some ethical concerns raised around prioritizing this group of people for universal or Medicare for all health coverage are as followed: equity, bodily autonomy, informed consent, and health privacy. While enrolling onto Medicare during pregnancy is not a requirement, it should be considered over fears of loss of personal liberties. Having health costs covered will allow pregnant women equal access to essential services. Although equal access does not ensure equitable access, some women that have pre existing or chronic diseases prior to pregnancy and following the standard care may not provide the care required for the best possible outcomes. Universal health care might involve mandatory screenings or interventions for pregnant women, which would raise concerns about bodily autonomy during pregnancy and informed consent. This policy has an opt out notion, and screenings would warrant proper referrals. For example, if a drug screen comes back positive, police should not be involved. Rather, an enrollment into a medical treatment or medical facility treatment plan should be installed. Universal health care may limit a person's ability to make decisions about their prenatal care. Um, for their personal or religious beliefs, one can still make the point that enrolling is not a requirement. Lastly, health privacy is going to be a concern over the last year as abortion care and states' rights have become an issue at play. Medicare for pregnancy needs to be established at the federal level and establish what health data can be collected, how the data can be used, how the coverage will work with abortion care in this system, and ensure individuals' privacies. Due to extreme bans in some states with abortion, it may be in the best interest of the individual to not enroll in Medicare program if planning to terminate a pregnancy. Here are the references for this presentation. And I wanted to thank you for joining me today and thank you for your attention and let me know if you have any questions.